Okay, folks, thank you very much. And thank you for that introduction, Brad. I appreciate it. Uh, thank you for inviting me. Thanks to the RMS team and everything they do for the advancement of pharmacy and adapting to change like they have to keep us in the state of the art, if you will. I appreciate everything you do with Retail Management Solutions. So as Brad said, we're going to talk about medication synchronization. I cannot imagine this day and time practicing in a pharmacy that does not have some type of synchronization program. I've been doing it about 12 years. Again, I can't imagine going into a pharmacy that does not have. I do a lot of presentations. I'm surprised at the number of pharmacies that do not have a synchronization program. I can assure you that it will change your business, and quite frankly, it can change your life, as you'll hear in just a little bit. So I've got a lot to cover in a short period of time. I am from Mississippi. I generally talk slow. I'm going to talk fast. It may not seem like it's fast for you guys, but it does to me. So hopefully we can get all the content covered, and we'll just jump right in. This is my practice sites. I have 4 pharmacies. I won't get into all of them. Tyson Drug Company, we're in Mississippi. I'm in North Mississippi, a community called Holly Springs. If you want to search for Tyson Drug Company in Holly Springs, Mississippi, there's links to all my other sites. You can see some of the things we do if you're interested in doing that. But let's just jump right in. Practice of pharmacy is rapidly migrating from to a value-based healthcare system. And actually, we're migrating into that value-based healthcare system. Most of the other healthcare entities, HMOs, ACOs, insurance plans, they're all migrated. They've all gotten to be a value-based healthcare system. So we're going to talk a little bit about what that is. I put the slide up there on the left. It's dated, and it's dated for a reason. That thing's probably several decades old, but quite honestly, there's a lot of pharmacies, a lot of community pharmacies practicing just like they did decades ago. Filling as many prescriptions as quickly as you can, getting patients out the door, and really not providing any health care. So years ago, a decade or so ago, when reimbursements, dispensing fees were decent, and you could actually make money on the product, that kind of practice was comfortable. But was it a care model? No. Filling as many prescriptions as quickly as you can and getting patients out the door is not a care model. So because we're migrating into that value-based healthcare system, those reimbursements, I don't have to tell you, have gone down. DIR fees have entered the picture. So you cannot continue to stay in business if you're just strictly looking for higher reimbursement fees. If you're focusing strictly on chasing reimbursement fees, then I think it's a race to the bottom, and I don't know how long you'll be in business. So you've got to learn how to change, if you will, and migrate from that reactive. And by the way, this picture on the left, that's a reactive business model. It's a completely broken business model. We're reacting to patients. Quite frankly, patients have been training us for decades. We want to adapt to every patient that walks in to what they need or what they think they need. So we need to change that broken reactive business model into a proactive business model to where we're training our patients now, and that can be done. We want to get over into the picture on the right where the pharmacist is actually out talking to the patient, has time to talk to the patient, finding their pain points and figuring out the solutions to their pain points. So we've got to get away from that reactive, broken, chaotic business model and get it organized. When I'm talking about your maintenance medication, that's 70% on average, that's 70% of your business. If you get those maintenance prescriptions under control, then 3/4 of your day is done. So it's real and it can be done. So I was one of those pharmacy owners where, decades ago, they're start talking about MTMs, Marixa outcomes, looking at your equip numbers, getting patients enrolled in a diabetic education program. All of these things they wanted us to do. And what was my reply? I don't have time to do all that crap. Looking back on it, what I was saying was, I don't have time to efficiently run my business, or I don't have time to take care of my patients. So I have a friend of mine, a dear friend of mine, he said this several years ago, everybody wants progress, but nobody wants change. And you cannot have one without the other. About 10 or 12 years ago, I closed my pharmacy and I went home. My family, my wife and children were not there. They were probably gone to a ball game that I didn't go to because I was married to my pharmacy. I just sit down on the sofa. I didn't turn the television on. I just sit there and I was mentally exhausted. And I thought to myself, this is not how my profession, that's not how I intended it to be. That's not how my career I wanted it to be. I said, I got three choices. I could continue to complain about it, and everybody around me was sick of that. I could just accept it, try to smile and say, this is the way it's going to be. Or I could change. If I wanted to progress, how was I going to change? I needed to change, but what was I going to change? But if I wanted to progress, I had to change. What was I going to change? I reflected on my day that day. Who came in? I love my patients, don't get me wrong. Some of those patients that were in today were in a couple of days ago, last week. I don't have to paint a picture for you guys. These people taking multiple medications are in multiple times a month. And we love them. We know them all. You know, they want to chat with you. When they bring that one bottle in today, they want a little chat with you. Last week, they wanted to chat with you. You got hundreds and hundreds and hundreds of patients that want to chat with you several times a month. Well, that's what causes a lot of the chaos, confusion, and all. You're trying to do so much, you just can't do it. So I thought, why can't I organize that? Those people taking multiple medications, why can't I come up with a system where they get them one time a month, come into the store or deliver one time a month? And then why can't I come up with a system to where I contact them several days in advance, have a staff member talk to them about their medication, to resolve all of those fires that pop up when they walk into the store. Something's wrong with the insurance. They don't have a refill on the prescription. You know, all the things that happen, I don't have to tell you. That can be done in a controlled environment, if you will, away from the pharmacy, so we don't have to deal with it in the trenches. What I was talking about was medication synchronization. I didn't call it that at the time. Taking a large group of a completely chaotic, reactive business model and organizing it. Okay, so the next day, I'm excited. I wake up, I go into my pharmacy and tell my staff what we're going to do. And they say, that sounds great, Bob. How are we going to do it? And I said, I don't have a clue how we're going to do it. So we just started communicating, talking. I chose my pick to be kind of my sync champion. And we talked about what this thing might look like. And we just dug in. And I didn't have all the tools that you have available today. Most dispensing fees have some type of synchronization program built in. I didn't have any of that. I just was out on my own, and I just did whatever I thought I had to do. And we just kind of kept fighting and fighting and fighting. And I'll be honest, there were so many times during this process, I wanted to throw in the towel and say, this is not worth it. Every time I thought like that, and this is great advice for you guys because it's going to happen. Every time I would get frustrated, I would think, you know, Bob, you may not be going the right direction, but you're not going to go back where you were on that sofa that night because I was miserable. So I kept plugging. I kept adding more patients. So it finally, and how did we start? I didn't have the roadmaps you guys have today. I got Susie and put her in the back room with a desk and a telephone and a label printer. And the first person that walked in with a sack full of bottles, I said, John, how would you like for all these prescriptions to run out at the same time every month? He said, I would love that, Bob. And I went back and put them on Susie's desk. And I said, let's figure this out. Again, you have the tools to do it. So let's talk about what you need to do. You got to get your team motivated. Again, I told you you need to choose a sync champion. You can't do it all. One thing I learned to do in my career was learn how to delegate. I was one of those that thought I had to come to the pharmacy an hour before it opened, fill up the drink machine, put vials in the bins, put sacks under the cash, had to do everything. And I know a lot of you feel that way now, but I learned to delegate, and what when I started delegating to other people to do these things, they got it done a lot better than I was doing it. So I chose my pick to be my sync champion. And so I laid a notebook by his station and I said, today, right, I want you to jot down a little note of everything you did or do today. Just make a little quick note. And so he did throughout the day. And this is an example of what happened. All these things that he did, some of them I mentioned earlier that I was doing, a lot of things he did, there was only 4 of them that a pharmacist had to do. So I asked him to start learning how to delegate and prioritize his time. And so we had regular meetings, and I strongly encourage, once you choose your leader and your leadership team, you have regular meetings with them. So important to have regular meetings with them. We have daily huddles every morning in the pharmacy. My staff does. And they talk about the good things that happened the day before. They talk about the not so good things that happened the day before and what maybe they could put in place to prevent those not so good things from happening. So you have regular meetings and you delegate. Me as a store owner, the lead, the sync champion, they can't do everything, but they can see that everything gets done. And how do you do that? You have regular meetings and do some other things we'll talk about. I don't care whether it's a high volume pharmacy or a lemonade stand. If you add some structure, if you organize it, it's going to be more efficient and it's going to be more profitable. Years ago, I went to a webinar. Not a webinar. We're doing so many webinars lately. We think everything's a webinar. I went to a conference. Believe it or not, we used to have live conferences. Went to a conference, and there was a guy named Tom Feltenstein there. He was a marketing guru. The reason I have the McDonald's box there, he created the Happy Meal, and I think he had a pretty good idea there. But he made a statement during his presentation that one of the reasons that small businesses fail or maybe don't succeed like they want to is they do not train their staff well enough. They do not spend enough time training their staff. How does that relate to pharmacy? I grew up in an environment, and I'm sure a lot of you have this same scenario now, to where we had our A-team tech. Boy, that tech is great. That tech knows everything we want done on a daily basis. They get it done. They've been with you a long time. They know your moves. We know their moves. Then you got the B-team techs that aren't so efficient. Why are they not so efficient? You haven't spent the time training them. So you're scared to death you're going to lose that A-team tech. If they're sick, your day is chaotic because people aren't as efficient. So in my practice, what I've done in each station, they know what they're supposed to do, and every 4 hours they rotate. And so they learn everyone else's position. So if one of my techs is absent, sick one day, then there's somebody there that can step into their role. I no longer have A teams or B teams. I have all A teams, and it makes a huge difference in the flow of your pharmacy. And that's so important, is you've got to sit down and take a look at how your pharmacy is flowing now and what you want it to look like. Write it down on a whiteboard, or get your team together on a table with butcher paper and write down everything and how you imagine it's going to look, and it's going to change, but just get it in the back of your mind what you want it to look like. So workflow obviously is going to change when you start developing a synchronization model. I mentioned earlier the technology that's available now that I didn't have back when we started. Most all dispensing systems have some type of synchronization program in place. Monday morning, you need to take a look at yours. If you're wanting to start a synchronization program, get with your sync champion, your lead people, and review and see what your technology vendor can bring to the table as far as synchronization. If yours does not have a synchronization model, there's third-party vendors out there that can interface with your dispensing feed, pull those patients out that you want synchronized, and do the juggling. One of the most important things is you want to develop policies and procedures, written policies and procedures. As you go thinking about what's got to happen at each workstation, write down, and it doesn't have to be anything, some fancy binder, on a piece of notebook paper, write down the procedures that have to happen at each one of those stations. It's like a basketball team. Basketball teams practice. They have a book of plays. That's their policies and procedures. When they practice these plays, each team member has their job to do. If they do not do their job, then they're not going to score a basket. Can you imagine a basketball team having two plays? One offensive play, go score a basket. The other play is a defensive play, just keep the other people from scoring. I've actually followed some teams that I think that was their policy. So how does that relate to pharmacy? You have each station knowing what they're doing. Can you imagine your policy in your pharmacy being, okay, here's our policy on filling prescriptions. If somebody walks in with a prescription, let's fill it. Can you imagine the chaos? And I know none of you are down to that level, but some of you do not have policies and procedures written down at each place because each team member has to do their place or it doesn't flow properly. You're going to continually improve upon that as you get into it and you see things happen that you want to change. Continuous quality improvement. Well, that sounds important. It's really saying what's working and what's not working. And let's write down what's working and figure out what's not working and see if we can make some changes and write it down and make it work. Encourage your team, your entire team. Work with your sync champion to make certain the whole team gets involved. If you've got a tech that's in the back of her mind thinking, you know, if we did it this way, it may work better. Encourage your team to bring those ideas out. You know, as a store owner, I don't have all the answers. And that's how my team has really gotten involved, as I encourage them to bring ideas to the table. And we use some of those ideas. I'm not afraid to use new ideas. They may work, they may not work. If they don't work, I don't get upset. Let's move on. But once you use some ideas that a team member has brought to the table, it's contagious. So please encourage your team to bring ideas. In this short time, I cannot give you a step-by-step method of exactly how to do synchronization. What I can do is give you 5 key points to where you can take back to your pharmacy and figure out how you want to do it, how I want to do it. And it's based on several things. How I want to do it's going to differ from you based on what technology you have, how you want your workflow, your store layout. So I'm going to give you the 5 basic features that you need to endorse and work on, and then it's up to you to go back. So you start with which patients you want to start synchronizing with first. Remember the example I gave you earlier is that patient walked in with a sack full of bottles and we started with him. That's totally the wrong way to start. So, but I didn't know, I didn't have a roadmap. So I didn't have webinars to go to. I didn't have people writing stories about how to synchronize. So how do you recruit? What kind of patients are you looking for? I strongly suggest starting with oral contraceptives. Those young women on birth control pills, that's an easy one to get synced up. They're going to get those each and every month. They want to get those each and every month. And when you explain to them, however you choose to do it, that you're going to call them a week or so before they're due, tell them when it's ready to be picked up or delivered, and then do it. It's the return on that is amazing. I absolutely love it. Plus you learn how to get medication in synchronization. Also, you may want to consider getting a relative or a friend that takes 2 to 3 maintenance medications. So if you boo-boo on them, they don't get mad, they're not going to leave you. I would strongly suggest setting goals, setting small goals. The worst thing you can do is say, I'm going to start out by getting 60 new patients on sync. Start out with 10 the first week. And if you're comfortable, maybe bump that up. I'd go with 10 for the first 2 weeks. Get your staff comfortable. Let everybody understand what's going on. So the second point there is how do you get them enrolled? Once you identify which patients you want, how do you enroll them? You want to run reports of all your patients on oral contraceptives, or those friends or relatives on 2 or 3 maintenance medications? Do you want to call them in advance and tell them you're going to put them, set them up in the synchronization model? Or do you want to wait till they come in the store and create a script and you'll identify those patients? The birth control pills will be obvious, but those other patients, you'll need to think about how you want to identify that they're in the sync program. Okay. So it's up to you. Do you want to call them in advance? Do you want to wait till they come in and have your staff give them the presentation or the script you have them, say, hey, Miss Jones, you've been identified as someone would benefit for this, and tell the patients the benefit, how it's going to benefit them, and we'll talk about that in a minute. The middle feature here, the short filling, that can be the most confusing on the beginning, but once you do it, and once you get more and more patients, like my staff now, they can get a patient enrolled in Sync. It's like tying their shoes. They just know how to do it because they've done it so much. So short filling, what I mean by short filling, as you get more patients that are on multiple medications, you're going to have, they never run out at the same time. We've already established that. That's what causes all the chaos. You want them to run out at the same time. So you got to identify what we call an anchor drug. It could be an HIV drug that costs you $5,000 for a bottle of 30. You don't want to break that bottle, but you want to sync everything. You want to short fill everything else to that, meaning you take a look at their profile, and if they're needing their lisinopril, for example, it ran out today, and you normally give them a 30-day supply, but you look at your anchor med and it's coming due in 15, then you want to give them 15 of your lisinopril medications, and look at their other medications. You may give them 10 of something else so that they all run out when that anchor med comes due. And obviously you explain to these patients when they get a bottle, it's only got 10 meds in it, why you're doing what you're doing. So it takes a little effort on the front end, but believe me, it pays off. Now you're going to get into insulins, eye drops, PRN meds are never going to run out with those maintenance medications that have to be received every month, have to be taken every month. You'll start learning how to juggle this. This is something your staff will learn how to do as you get into it. For example, if a patient takes 10 meds, one of them is a insulin, and you give them 9 meds because their insulin's not due for a week, the worst thing you can do is ask that patient to come back in a week, or you have to deliver again in a week. So your staff will learn who these patients are. In that example, you want to go ahead and give them the insulin, and if you can adjudicate it, fine. If you can't, then you future adjudicate it. You look and see what their previous copay was. They're regular patients, that come in your store, you know them. So if the copays come up differently, you can explain to them. Normally, they're going to be the same. So these are the things that you learn. Your staff will learn how to juggle those things you discuss on a daily basis of how could we have resolved this. Your sync caller, you're going to have to take one of your key techs that understands everything about your business, and they're going to start calling patients. Now, I mentioned earlier that my staff rotates. You do not want your sync caller to rotate. You want your patients talking to the same person every month as much as possible. So you identify that person that's going to call them, the one with the best personality that could really talk to these patients, understands their medications to the top of their ability. Two or three things that's extremely important with that sync caller. The first thing is you get that sync calling station out of the hustle and bustle of your pharmacy. I made that mistake. I had them in a back room right behind my pharmacy. My pharmacy staff was constantly calling them out to help them get caught up. Counterproductive. Get that patient in a private office to where the staff cannot get to them and interrupt them. Now, in the beginning, that sync caller is probably going to be calling these patients, then coming out and filling herself because there's not going to be that much patient load. As you grow, and you will, then that sync caller, her responsibilities are much bigger, and she's going to have to just solely do sync calling. Also very important to impress from the beginning that sync caller, after they talk to the patient about their 10 medications, and you'll have a script that you'll create of what you want that sync caller to say to each of those patients. And you'll need to sit down and go over that. Your leadership team, y'all need to discuss on what has to happen on that call. One thing that absolutely has to happen on that call is you want that, by the way, the sync caller, after they call the patient and everything's good to go, they're going to adjudicate the claim right then. So, and you want them to do that because they're in a controlled environment, not interrupted. They can pick up on any problems that may happen. You want that synchronization person to create what I call a clean claim, meaning they have chosen the right NDC, the one you have in stock, no insurance problems. Do they search for a discount card if it's a high copay? Or all the things that we all try to do out on the bench, in the trenches, while the phones are ringing, everybody's trying to talk to you, and you're trying to figure out why she doesn't have a refill or look for a refill. Your sync caller can do all of that behind the scenes. You don't even know it's going on. She's cleaning up all your prescription refills behind the scenes. Extremely important that you train that person to do it properly, because eventually these calls, these prescriptions are going to go out into a dispensing area. You may want to have your sync dispensing area separately. It's up to you. You may want to have it mixed in with your regular prescriptions that are waiting, but you have to figure out a way of differentiating those prescriptions, because you can work on these sync prescriptions in the downtime, but you got to take care of those people who are waiting. We just talked about the processing and filling. So once it's adjudicated, where does it need to go? What needs to happen? Is it a delivery? Does it need to go in regular will call? So you're calling the patients, and I would suggest setting it up, calling a week in advance. You're on that call, the sync caller is going to let them know when those medications are going to be ready, and I would develop some type of system to let the patient know when they're ready for pickup. Originally, we used to have our will call set up on the day we're supposed to pick them up, the day their old meds were to be run out. I mean, we were really focusing on adherence. We've since changed that a little bit. So when we put them in will call, they're ready to be picked up. If the patient wants to pick them up a day or two early, they can, and we identify, or we let them know that they're ready for pickup. Real quickly, 5 things. How do you recruit patients? How do you enroll patients? How do you short fill them? What happens on that synchronization call? And then how do we process them after they've been called? You're taking that unorganized, chaotic, reactive business model, and you're creating a proactive way of doing it. I've covered this really quickly, but once you focus on these five processes and incorporate it into your technology, into the way you want your workflow to work, you'll start seeing the benefits. Obviously, your staff roles are going to change. They're going to be in different positions. Remember, each workflow station has to know what their role is. I've got this example. I had a staff member that was quarantined COVID last year. She actually carried her laptop that had our dispensing system on it, and she worked from home. You can see her exercise bike in the past. She was calling patients and she was adjudicating prescriptions. So you can adjust to change, which is what this is all about. What Brad and his team do so well is figure out what's changing and adapt to it. So obviously last year there was a lot of changes that we had to adapt to with COVID. We all had to maybe close our doors for a while. How did we adjust our workflow then? What's interesting is when we did close our door for a couple of months, it really did not change my dispensing habits. Now, there were obviously a lot of acute prescriptions that we didn't get. People weren't going to the doctor's offices, and you know, there was not much acute stuff, not much cough and cold. But my maintenance medications never missed a lick. My patients knew they were going to get their medication. They changed our sync call because of COVID. They weren't coming in the store. We had to tell them our process, and they adapted very well. We were talking to them anyway. So we just told them, hey, their doors are closed. This is what you have to do. So when you have your business organized, when things like COVID hit, it's easy to adapt to that change. Where that unorganized reactive business model, what were those people going to do? Can you imagine them calling you and coming up to a curb service 4 or 5 times a month? I don't know how people adjusted to that. So you got to rethink your staff role as roles as things change. So benefits. What about the benefits for your patient? We just talked about it. Convenience. They're coming to the pharmacy 1 time a month, or you're delivering 1 time a month instead of multiple times a month. A lot of you who had to have deliveries, how many of your patients do you deliver to more than 1 time a month, or more than 1 time a week, or more than 1 time a day? You know, that's a great candidate for starting your sync program. Obviously, you're optimizing their health goals, which is, again, as I started out, that's where we're going, value-based. We want to create healthy outcomes for our patients. When you get them enrolled in a synchronization program, they're taking their medications like they're supposed to. They're healthier, which translates into less trips to the emergency room, to the doctor, to the hospital, which translates into huge savings for the payer. So we now have payers that are identifying high-performing pharmacies and paying us for stuff as simple as synchronization. Obviously, the pharmacist now has more time to actually talk to the patient, find their pain points, and visit with them. What you're interested in more, obviously we're all interested in benefits for the patients, but what's it going to do for my pharmacy? The fire extinguisher there, a lot of the fires that have been popping up out in your dispensing area. Remember I talked about what the sink collar can do to prevent all these fires from popping up? Your sink collar is taking care of a lot of that stuff in the back room. Better communication, you're more organized, okay? Back to the lemonade stand. You know, it doesn't matter what's a high volume pharmacy or lemonade stand. If it's more organized, it's more efficient and more profitable. Your inventory goes down. Your cash flow increases. How does that happen? When you really get a robust synchronization program, those 10 prescriptions you're calling on that patient, you may not even have them in stock today. Once you talk to that patient, you create a process where you order those medications, they come in and you fill the prescriptions, put them in will call or delivery, whatever. They don't stay on your shelf. That money's not sitting on your shelf, it's moving. Staffing, you can control your staff. You have a better feel of when you're going to be busy. I used to lose sleep at night the first 3 nights of the month because what was going to happen the next day. Currently, the first 3 days of the month, the busiest part of my pharmacy is the cashier. All those prescriptions for those first of the month patients, maintenance prescriptions, I've got them ready and in will call. So that workload in the pharmacy, the dispensing area, is greatly decreased the first of the month. Increased prescription fills. In a traditional pharmacy that does not do synchronization, you fill a prescription, a maintenance prescription, 7 to 8 times a year. When you have them in a synchronization program, you fill them 12 or sometimes 13 times a year if you're doing a 28-day cycle. So you get incremental refills. Studies have shown that for every 100 patients you enroll in a synchronization model, you have a $90,000 increase in revenue. I'll repeat that. For every 100 patients that you enroll in a synchronization it's estimated a 90% increase in revenue. I have pharmacy owners when I do this presentation, and I've trained hundreds of pharmacy owners and staff across the nation on synchronization. I have a lot of them say, I'm not doing any of this till I get paid for it. Folks, you're getting paid for it. It's a side effect. Equip scores. So with having a robust synchronization program, I have time to work on my business instead of just in my business. So we have time to focus on our equip numbers and take a look at those problem patients. Our equip numbers are by side effect going to get better because you're putting in a synchronization program which improves adherence, and obviously you know that that's part of the equip numbers. It allows you time then to that you can make them take their medication line. Again, equip scores being better lowers your DIR fees. We all know how terrible DIR fees. Talking to my accountant not long ago, of what I'm understanding, pharmacies average somewhere 5% or more. 5% of revenue are their DIR fees. So mine run less than 2.5%. Okay, so what does that mean? Let's take it for an example, a $5 million pharmacy. 5% of their revenue, 5% of that $5 million are DIR fees. That's $250,000. Mine run less than 2.5%, but let's use 2.5% for ease of figuring. 2.5% of that $5 million pharmacy is $125,000. You have just saved $125,000 on your DIR fees for having a robust synchronization program. That's a side effect, okay? So you are getting paid for this. You mentioned clinical services a little while ago. Again, because it's allowed me to work on my business instead of in my business, we've developed a clinical services program within my pharmacies. I've hired a clinical pharmacist to run the clinical program in my pharmacy. He not only, his goal, he had to pay his salary and make a profit. And within a year and a half, he is doing that. And I'm really close to looking at hiring another clinical pharmacist because there's so many revenue streams on the clinical services. Again, I mentioned you get payers are now looking for high performing pharmacies. Pharmacies that have migrated into that value-based system, just like we're talking about, and they're offering to pay us to do some of these things. They see the benefits for their patients. So where I'm going with this is synchronization is the secret sauce. I train, as I said, hundreds of pharmacies every year to do synchronization, and nothing makes me feel better than 6 or 8 months after they've been here. I run into them. They say, Bob, this is great. Using your advice, we got 1,000 patients in our sync model, and right now, guys, I currently have 3,000 patients, but I'm not going to poke my chest out about bragging about I've got 3,000 patients. It's what I do with those patients that I'm proud of. So when those pharmacy owners say, man, I got 1,000 patients in my sync program, I look at them and say, well, what are you doing with them? And they say, what do you mean, what am I doing with them? I said, it's what you do with sync that's important. Sync is the secret sauce that allows you to do all this stuff. Are they in a diabetes management program? Are you doing immunizations? You know, what it opens so many doors, clinical services. So again, it's the secret sauce to improving your business, increasing revenue, increasing your profit. Let me jump to the next slide here. This is my family. I have 2 older sons, one on the left holding a grandchild, and one to the left of me. That's me holding the other grandbaby on the right. The one in the hat's my other son. Both of my sons are attorneys. I'm proud of them, in spite of being attorneys. But neither one of my older sons, early in high school, they said they're not going to be a pharmacist because, Dad, we see what it's done to you. Well, folks, that hurt. So fast forward, the one on the left there, my oldest son holding my grandbaby there, he graduated in December, about 1.5 years after I started controlling my business instead of it controlling me. That was about 1.5 years after I started this process. He graduated in December in computer science from Ole Miss. So he came up and got me. We went Christmas shopping. And so his name is John Travis. I call him JT. And so we stopped and had lunch. And I said, well, JT, you graduated in computer science. What are you going to do with the rest of your life? He looked at me, and I'll never forget this, folks. He said, Dad, I'm thinking about going back to pharmacy school. I was stunned. I said, JT, what's happened to you? And he looked at me straight in the eyes, and he says, no, Dad, what's happened to you? You are fun again. He said, when we call the pharmacy, you can actually talk to me. You actually come down to Oxford and carry us out to eat, and we have fun. When we're at your house on the weekends and you come home from work, we don't run to the other end of the house to get away from you because you're so irritable. Folks, I knew what the synchronization model had done for my patients. I knew what it had done for my business. That night, sitting on the sofa, my thought process was selfish. I wanted to make my life easier, and it certainly did that. I knew what it had done for my patients. I knew what it had done for my business. That moment, that conversation with my son, JT, I realized what it had done for me. That night on the sofa, I was miserable. I enjoy my family now. I'm happy at home now. My family enjoys being around me. We go on vacations together, all of us. We go to dinner together, all of us. And they love me again. I'm not saying they didn't love me, but they enjoy being around me again. So the guy with the golf club there, I love playing golf. There was a period of time, 5-year period, where my prescription volume increased 65%. So because of synchronization, and I was doing it much easier. During that same period of time, my golf handicap went down. For those of you who don't play golf, that means I was playing better golf. Was I playing better golf because I was playing more golf? Or was I playing better golf because my stress level was down? I can 100% say that it's because my stress level was down. The shaking hands there, because of synchronization and the fact that I'm working on my business instead of in my business, I have created so many more relationships that I never thought I would have, not only within the medical community, just within the general community as a whole, going to meetings, church meetings, Rotary clubs, and explaining what we do for our patients. Businesses around town are now encouraging their employees to come to Tyson's because they get better care there and they're healthier, which keeps them at work. So back to that night on the sofa, I was absolutely miserable. Those three choices I had, I chose change, and I stuck with it. And so it's made me a different person. Again, I knew what it did for my business. I knew what it did for my patients, but it's what it can do for you that was the most important. So I hope I didn't go over time too much. I'm happy to answer questions. I covered a lot of material in a short period of time. I really wanted to get more into why it's important that you do synchronization, not exactly how. You guys have got to get in there and figure out. Going forward, I'll help you any way I can, and I'll certainly answer any questions that we have time for today.
Okay, welcome back, Bob. Wow. I just want to tell you, thank you for the stories. Touching, and quite frankly, my favorite presentation that I've seen since we've been doing Climb. I just can't tell you how much I appreciate you sharing with us everything you just shared.
Well, you know, what's interesting about the way I did this presentation about more the why is exactly how to. You know, pharmacists going to have to figure that out mostly on their own, and they will. You know, it's not a hard process. If I can do it, anybody can do it. But the why is what's important, what it can do for your business. I think we're all, you know, so many of us get trapped in a rut. And one of my favorite, you know, we get in a rut. We keep doing the same thing over and over to expect different results. And what I like to say is the only difference between a rut and a grave is the depth. You know, eventually it's going to kill us if we don't get out of that rut. So
oh, absolutely. You know, and it really resonated with me because my dad just sold his independent pharmacy that was been in our family since '55, and fortunately sold it to a young couple. It's remaining an independent pharmacy, but you know, when you talked about your sons not going to pharmacy school, my brother and I did not go to pharmacy school. So I have one brother, and same situation. He said, my dad told us not to go to pharmacy school. He said, you know, I just don't like the way this is going. Just, you don't want to do this. And you know, he changed though as time went on, and I think he regretted that in the end. But I founded RMS 22 years ago, and I've been around pharmacy my whole life. But I'll tell you what, for all of those of you listening, all you pharmacies, I mean, I hear you with the IR fees and bad reimbursement rates and so forth, but business is hard. I mean, I've seen a massive change in the technology world in the last 22 years. And if we don't change, we fail. And we stop. I abdicated some responsibility instead of delegating quite a few years ago. And there's a period in RMS's history where we failed. We were not doing what we needed to be doing. And it cost us. It cost us a lot of independent businesses that left us because they didn't feel we were doing the things they needed. And, you know, and we had to adjust and change, and you have to do that if you want to survive. So I think, to me, I mean, I absolutely need to be doing MedSync, and I love that you talk about that. But I think, to me, the most important part of what you talked about today was change, you know, and adapting to the environment. And thank you so much for that. And pharmacies, you need to do it. So we of course, we're running long, but that's okay, because that was so important. There are a couple of questions. I am just going to take one though. So if you briefly, one of the questions was, what are some of the common pain points that you experience with MedSync programs? So if you could do that in a few minutes.
Yeah, I'll do it really quickly. One of the most important thing, and I touched on it just a tad, but when I train pharmacy owners, when they come in here to learn how to do sync, when they get back to the pharmacy, and it took me several people calling and asking me about this, after they get, you know, to the 50 to 100 patient range, it begins to get very difficult. And I mentioned that how I struggled on the beginning, and looking back, and it's because you're taking a group of patients, a small group, and you're trying to move that needle over here. Well, you start the needle moving, and you've got a small group of your patients that you're doing something different for. That's the pain point. It's hard because the rest of your patients, you're doing it the same old wrong way, if you will. So you got a group of patients you're doing it differently for. You have to work through that. So once you get that needle flipping to the other side, and the majority of your patients are in a sync model, then it becomes your normal way of doing business, and it's easier. So please, when you get to that 50 and 100 patient range, I've actually had pharmacists call and say, Bob, you said this was going to be easier. It's a lot harder. Well, I had to figure out why they were telling me that. It's because that pain point is when they get to that 50 to 100 patient range, and you got to work through that, get over that hill. I mean, you're climbing up that hill trying to make things better. You don't want to go back to that sofa that I was at. So keep going and keep going. And I could have easily done that, but I didn't. So once you get to that, again, we got 3,000 patients, and it flowed. We contact each and every one of them every month. So that's the pain point. The other real quick one I'll mention is buy-in from your team. And when I first came in that day and told them what we're going to do, and we started doing it, I think for a while my team thought I was crazy. Hell, there was times I thought I was crazy. So, but anyway, you have to keep encouraging your team and say, no, we're not trying to replace anyone. We're trying to make your job easier. And when you're in your pharmacy 3 or 4 months after you start synchronization, and you hear that key tech say, why isn't Miss Smith in the synchronization program? You're there. You're there. Your team has bought in. They get it because they see then how much easier their life is, how much easier their day is, and they're not mentally exhausted at the end of the day like they once were.
Yeah.
Okay.
Yeah, buy-in is so important, and we see the same thing here. You know, when we make a change, and you're absolutely right. You know, nobody likes the word change.
Right.
But we do want to progress, right?
But everybody wants progress. That's right.
Listen, thank you so much. I would
Thank
love
you.
to have you back. I hope you'll come back at some point down the road here and join us again. We really do appreciate your time. So have a terrific rest of your weekend, and we'll talk to you soon.
Thank you and your team for what you do, Brad.
Thanks, Bob.